Okay, excellent. Hello, and welcome to another Rush Generations Health Education Lecture. We are delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. I am Grisel Rodriguez Morales, Rush Generations Program Director, and I'll be your moderator for today's lecture. It has been a while since the last time I moderated one of the lectures. And today it's a special treat for me, not only because we have two fabulous clinicians I've had the pleasure of collaborating with throughout the years. I'll introduce them in a minute, but they're also going to talk about caregiving, which is a topic that hits home for many of us. I'd like to first thank our producers, Franco Sambataro and Hannah Weitzman. Franco is going to help us manage the chat and other key aspects so that we all can have a great discussion. These lectures, as you know, we are live streaming them via our YouTube channel, where we have dozens of other health education lectures that you can always refer to. So please let your friends, family, colleagues know about this channel. And when there's a lecture you've enjoyed and found helpful, share them with them so that they can also benefit from the valuable information that our speakers offer every other week throughout Rush Generations. And you can always subscribe, and that way our lectures will be at your fingertips. We also have a good number of people joining us via phone. And at the end of the lecture, you'll also have an opportunity to unmute your audio and ask questions. For those of you on YouTube, we ask that you please use the chat function to ask questions and or to add to the discussion throughout the lecture. We will make sure that your comments and questions make it to the presenters. We'd like to remind you that all the information offered here is for general informational purposes only. Always when it's something very specific to your situation, we ask that you seek professional advice. We just greatly appreciate you joining us. Okay, so let me get started. Ellen Carbonell. Ellen is an associate professor in the Department of Social Work at Rush University's College of Health Sciences. She's also a caregiver programs consultant at Rush University Medical Center as a licensed clinical social worker and adjunct faculty member in the School of Social Work at Loyola University. Ellen has over 40 years of experience as a social worker in individual and family programs in hospital, mental health, substance abuse, educational, clergy, and voluntary healthcare settings. Until March of 2022, Ellen served as the lead for Rush Caregiver Programming funded by RRF Foundation for Aging, and the collaborative work of the Caring for Caregivers model, which was funded by the John A. Hartford Foundation and recently was awarded one of this year's Chicago Innovations Awards, which is an honor granted to new most innovative products and services in the region. So kudos to you and the team. Ellen is now in a consultation role, continuing that work with Caring for Caregivers throughout the current 3-year grant period. And she willingly said yes to us when we asked her to join us today. So thank you so much, Ellen. Then we'll hear from Sarah Michelle Chen, a licensed clinical social worker, also with Rush University Medical Center. She has more than 15 years of experience working as a clinician, program coordinator, and research team member. Sarah has spent her career providing care management in long-term care and ambulatory healthcare settings, where she works to address non-medical barriers to wellness and improve health outcomes for patients and care partners, focusing especially on individuals and families impacted by symptoms of various movement and neurodegenerative disorders, as well as forms of dementia. As a result of her work with the Rush Movement Disorders Clinic, Advanced Interdisciplinary Movement Disorder Support Care Clinic, that's a mouthful, Sarah has completed advanced training and certification in palliative care with an emphasis on helping patients and care partners to better understand their choices and preferences for medical care and non-medical care. So a huge thank you to you too, Sarah, for joining us today. So let's get started first with Ellen.
Thank you so much, Griselle. And I'm just pulling up my slides. I'm coming to you from actually a caregiver conference where I'm learning lots of really important new things that are happening in the world of caregiving. So it's very exciting. Lots of attention is being paid um, to this movement now. Here's what we know about caregiving in the US. We know that there are about 53 million people providing care for older adults um, within this country, and the number is rising. In 2015, it was about 18% of the population, and that has grown to about 21% of the population because we as Americans are aging. And as that happens, what we're finding is that not only are there more and more caregivers, but that caregivers are actually taking care of more people. More family caregivers are also having difficulty with coordinating care. So you would think that as the numbers have increased, more attention would be paid to this and it would be easier to navigate these systems. But unfortunately, that has not happened yet. We can also see that more Americans are caring for someone with Alzheimer's disease or with dementia than ever before. And that number has increased by 4% just in the 5 years between 2015 and 2020. More caregivers are reporting that their own health is fair to poor. So 17% has gone up to 21%. We know that a lot more women than men are providing care, but men are catching up. So there are actually more men than in the past providing care for older adults. And we also are seeing that younger people are going leaps forward in also providing care for older adults. It's interesting that what you see in the African American population is that more women than men in the white population are caring for an older adult, and they're doing a lot more work. So I'll get to that shortly. 45% have had at least one financial impact. And this is something that is a big focus at the conference that I'm at right now, that caregiving is really sending a lot of people into poverty. People cut back on their work and are, as a result, have less money to spend on caregiving. But about 61% of caregivers at present are working. So here's what a typical caregiver looks like. And we talk about the sandwich generation being someone who's caring for a generation older than themselves and a generation younger at the same time. What we also see now more and more is the club sandwich generation, because people are providing care for multiple generations, not just two, but sometimes three and even four generations of people. The average is a 49-year-old woman with some college or completed college or advanced degrees. They're married, they're employed full-time, and they're devoting about 19 hours a week on caregiving for approximately 4 years. That's on average. Now, we know that with Alzheimer's disease, the length of care provision is greatly enhanced. So people are providing care for 10, 15, sometimes even 20 years. African American women are providing an additional 18 hours a week of care. above and beyond this 19. So you can imagine that providing all of this care on top of trying to maintain a job and to take care of other family members is really, really overwhelming. The typical care recipient is 77 years old, and it's the mother, father, or grandmother of the person providing care. And about 30% of those people have Alzheimer's disease. There are a lot of different roles that caregivers juggle. They are bankers, and they're extremely well-informed bankers because it's not just about putting money into the bank and pulling it out. It's also about trying to figure out how to manage Medicare and sometimes Medicaid, or both Medicare and Medicaid, which are both very complex systems. So if they're caring for someone older than themselves, they are typically trying to figure out how to work and navigate those systems together. They serve as sort of lawyers without degrees because there are legal issues that need to be attended to. And many times those legal issues have to do with advance directives, making sure that wills are in place, making sure that powers of attorney are in place, and those sorts of things, not only for the person they're caring for, but themselves as well. They're also serving as pharmacists, trying to kind of juggle various different medications prescribed by different providers. Prior to Care Everywhere, which you can opt into at Rush, and will allow you to see or allow providers to see not just records from their institution, but all of the institutions that are keeping medical records on the particular person. They also will allow that person to figure out what medications are being prescribed by whom and whether there are conflicts in those medications so that some may need to be reduced or deprescribed. Prior to Care Everywhere, it was just a fluke if somebody was able to say, as an older adult, to their practitioner, I'm getting this medication from this physician and that medication from that physician, and I'm using these 3 different pharmacies to try and get the lowest prices. And if somebody was able to figure that out for them, it was wonderful, but unusual. Caregivers are also serving as nurses, and they're actually providing medical care that would be pretty daunting to a nursing student. And they're doing this without medical training for the most part. So they're managing central lines for people, catheters, various peg tubes, and ways to provide nutrition for the person. They're providing injections. They're doing a variety of things that are really, really difficult to manage. And I heard from one person today at this conference who was saying, I had 2 medically complex children at home with very rare diseases. And then the physician was suggesting that I get trained to do some more things too. And she had to say, I cannot. I absolutely cannot. Of course, their caregivers are managing trips to physicians' offices, to social events, and to Rush Generation programs, and serving as kind of chauffeurs who need to juggle their schedules to manage the timing of these various events. They're serving as advocates, case managers, psychotherapists. They're chefs also and nutritionists. who need to provide special meals for people very often. They're doing hands-on care at some point in disease progression very often, so bathing and grooming and things like that, as well as completing or providing complete assistance with daily living activities, which can include not just making meals, but feeding the person that they're caring for. And over an extended period of time, you can imagine that caregiving takes its toll. It leads to physical strain and psychological strain. And so many, many caregivers are saying that their health is poor or fair, and that caregiving has decreased their health. They're experiencing strain and have a 63% higher risk of mortality than non-caregivers, which is very scary. Now, part of this can be explained by the fact that very often a spouse will provide care for another spouse. And so if they are older, adults in their 80s, for instance, there may be a situation where both of them are experiencing medical issues, but it's not always the case that it's age-related conditions that are causing these problems. And what we find is that the strain of care provision has caused lots of conditions that in part have to do with caregivers not having a lot of time to take care of themselves. There are also financial impacts on the caregiver. Very often, caregivers are paying about $10,000 a year to supplement the caregiver's ability to pay for their own care. And a lot of working caregivers are making or asking for workplace accommodations. So what that means is that they're working less eventually as the care needs of the person they're caring for increase over time. About 30% of female caregivers have decreased their working hours, passed up a promotion, passed up ability to travel. Many take a leave of absence or change over to Family Medical Leave Act time to provide care, but not everybody has that ability to take leave from an employer. And about 16% have quit altogether. What this also means is that they're paying less into the Social Security system as a result. And so not only are females paying more, earning less, but they're also suffering in their own retirement because of the fact that they haven't paid as much into Social Security. And many people are postponing retirement just to be able to finance long-term care for someone that they're caring for and to have enough money for themselves. Of course, there are positive effects of caregiving, and about 30% of caregivers say that they're not having any stress or negative health effects. Now, what we found at Rush is that a lot more African American caregivers are saying that they're not having feelings of depression, feelings of anxiety, any sense of burden. And yet, what I told you before is that they're putting more time in as caregivers. So part of this may be explained by resilience, which, if you think about why are they so resilient, you can see that there may be both positive and negative reasons for this. But it's also a part of the culture, as it is for many other cultures as well, to just know that this is a part of what they do as a good spouse, a good son, a good daughter, a good friend. And they're happy to do it and it fits with their values, which is a wonderful thing, as long as they're also caring for themselves at the same time. So taking care of things like getting mammograms, getting prostate exams, getting to the dentist on a regular basis, making sure that they're taking care of their own health needs so that not only will they be able to continue to provide care, but also that they'll be able to have a quality of life for themselves because they're people who deserve to be healthy. Many people say that caregiving has made them feel good about themselves. They feel as if they're needed. It's giving meaning to their lives. There's a certain circle of life that they feel is being played out. And that's really a wonderful thing. Paying back to someone who has cared for them well, and that the relationship is strengthened as a result. The important thing here is that caregivers do what feels consistent with their own values. So this happens especially if there's a situation where maybe a caregiver is caring for someone who was unkind to them as a child, who abused them either physically or sexually, or who just hasn't gotten along with that person and they haven't spoken for a long time. And what we do in our Caring for Caregivers program, which I'll talk with you about, is look at what are your own values and how do you want to live according to what you believe in and not what this person has defined for you in your life. You can sort of put that into a box and then operate from what's really important to you and what do you believe in. So people don't just experience as children the profound need and wish to be a caregiver when they grow up. It's typically not something that people plan ahead. They're very surprised sometimes to suddenly be a caregiver for someone that they really didn't think they would be caring for. And it's unclear as to when that starts. There's something called ambiguous loss that we refer to in the clinical world, which is about there not being a clear definition for a loss and not being rituals around that, not having expectations and celebrations or acknowledgments of some of those things that arise in life. And this happens when someone is a caregiver. It also happens when someone has a long-term illness in which they are declining in terms of their health, and other people aren't necessarily going to understand what that's all about. For the caregiver, they may not understand how these losses kind of accumulate over time and compound themselves. So they think, well, this person was diagnosed with, say, Alzheimer's disease, and that means, for now they're not doing too badly. Later on, they will have problems. And actually, there's quite a psychological shift that people need to go through in order to accept what this disease is going to mean for their own lives and for the person with the disease. Caregivers' roles and the tasks that they're going to take part in change over time. And you can actually kind of consider being a caregiver as being a career. There are a lot of stages that you go through. You sort of get promoted to more difficult positions as time goes on. You learn more with your experience. What you don't always learn about is reaching out for help. And very often it's hard to know excuse me, who to reach out to help, reach out for help to. So we're here to tell you that you can reach out for help to the Caring for Caregivers program, and I'll describe that shortly. Again, caregiving in the context of the family's life cycle, there may be a lot of feelings that emerge, and some of them will be in conflict with each other. So you can feel two ways at one time: grateful that the person is still here, upset that they are exhibiting certain behaviors that are getting under your skin. And it's perfectly legitimate to have those feelings. People often feel guilty about having the negative feelings. Those are a natural part of taking care of someone. Negative feelings and positive feelings are the norm, and that's what we expect to see. So, as one caregiver told me years ago, the issues in your family do not magically disappear when there's a diagnosis made and when a caregiver takes on that role. In fact, they really escalate. And so what you see is not only those positive and negative feelings going on the part of the caregiver and the care recipient sometimes, but there are all these old family of origin issues that can get triggered through the caregiving process. So needing to provide care for someone who maybe didn't provide this aspect of care to my expectation when I was a kid and I needed it, there can be some resentment about that comes out during the course of caregiving. Having a parent who is critical, sarcastic, not warm and fuzzy, that can escalate during the caregiving process. So all of these things need to be paid attention to, and we can help with adjusting to some of that. Learning a new set of skills and coping techniques is so true. It's not just about learning how to provide the care. It's also about how do I cope with what's happening in the other person's life and in my life as a caregiver. So I talked a little bit about the complexity of the medical care that's being provided. Wound care is a big piece as well, and people are not trained in how to take care of wounds that are difficult to heal. And so we find that caregivers are providing lots and lots of complex medical care and handling the equipment that goes along with it, which can feel really overwhelming and does change over time. So if someone is discharged from the hospital, they're typically shown, and the caregiver is shown what needs to happen. And here's how to use this equipment, and here's how to take care of the person. But then as the person is at home longer and diseases progress or conditions change or additional diagnoses are made, it can be the case that this care becomes much more complicated. And they may not have received training on those specifics. So that's also something that our program can help with. And in spite of all of this, what we found is that caregivers are very rarely asked, in only about 39% of the times when people are discharged, are they asked, are you able and willing to provide this care, and having an actual discussion about that. That's in depth. That's about what are the actualities of what needs to happen here. Very often someone will say, oh, of course I can do that, not thinking ahead to what that's going to mean in the middle of the night. If someone needs to be turned over, for instance, and they're twice the size of the caregiver, it may seem like, sure, we can have the person turn over in bed, but it means waking up. It means turning someone who may not be helping. So having a complex conversation about that is important. And only about 13% of the time are caregivers being asked, what do you need for this care to take place? And what do you need to take care of yourself? And then getting some information about that. Very unusual. The stress and burnout that comes with caregiving is higher than for non-caregivers. And so there may be some chronic stress that increases the risk of cognitive decline. And there are lots of reasons for this, which I've kind of outlined. There's also social isolation, and caregivers often feel that they have no choice but to provide this care. And this is something that we pay a lot of attention to in our Caring for Caregivers program, and work toward helping people realize that there is actually a choice, and they have made the choice to provide this care because of what they believe in. They're not just saying, I'll let the state deal with it. But it often means that they are staying at home a lot with the person and becoming more and more isolated over time, which causes problems with mental health. Planning for the future, I talked a little bit about advanced directives, and caregivers and care recipients both need to be included in those discussions. So I ran across this metaphor just recently, and I love it. Actually, my niece told me about it. She's someone who has dealt for a couple of years with a chronic condition, and it's the spoons metaphor. And you can find more information about this through the link that you see on this slide. So people will say, well, you need to take care of yourself, get those medical tests, eat right, exercise, see other people, meditate. This can feel like a big, long list of things that you need to be doing in order to take care of yourself. Add it to the list of all the other things that a caregiver is doing, and it can feel like I do not have enough time and I do not have enough energy. And we talk in our program about listing how other people can help, so that when they say, oh, I wish I knew what I could do to help you, you can say, well, let me look at this list and see. And it's not just, provide respite or take the person to an appointment for me, but it can also be nice to have. So like, I'd love to have you come over and have a cup of coffee with me. But the spoons metaphor is terrific because here's how it goes. They say you've got 12 spoons in a day, and each spoon represents 1 unit of energy that you have to expend that day. So altogether, you have 12 units of energy, each one represented by a spoon. So how are you going to divide those spoons for the day? You may, on a really difficult day, or if you're feeling down, have a hard time getting out of bed in the morning. And it may take 3 spoons to get up and stand on your feet, and 2 more to take a shower. That's okay. There are days like that. If there are a lot of days like that, then it's important to check it out medically to see what can be done to help. But those days happen periodically. But if you've got 3 to get out of bed and 2 in addition to take a shower or get dressed and prepped for the day, then you've only got 7 spoons left for the day. And how are you going to divide that out? You're going to need to take care of cooking, eating meals, probably making phone calls to take care of things you need to take care of. But what's interesting about caregivers is that you've got 12 spoons with which you need to take care of business for yourself and the person you're caring for. So it's really, really a great idea to think about the fact that your energy is limited in a day. And how are you going to make conscious choices about what you're going to do and what you're going to let go of? There are a lot of ways to reframe things. Do you need a shower every single day? Maybe not. Does the person that you're caring for need a bath every other day? Maybe not. So it's an interesting way to look at things. So here's our program at Rush, Caring for Caregivers. And we address how caregivers are identified in the health system and also how to support family caregivers in ways that will enhance their physical and emotional health and well-being. And we're doing this with a grant from the John A. Hartford Foundation to actually train people all over the country, train health systems all over the country on how to set up these programs. We start with a getting to know you meeting where we do some screeners to see what's going on with levels of anxiety, depression, caregiver burden. And the hard leap to make is that we're not looking at the person you're caring for, we're looking at you. We're looking to see how you're doing and what kinds of needs you have. And we do a really thorough assessment that covers your biological needs, your psychosocial needs, and your spiritual needs. And from there, we have additional programs. The main part of what we do is under Planning for What Matters sessions. And these are 1 to 5 sessions with a psychotherapist who will talk with you about what's going on with you and the care recipient, because they're linked together. We can't separate them. What happens in your life as a caregiver really overlaps with what's happening in the life of the person you're caring for. And what matters to each of you makes a difference. And all of that needs to be taken into consideration to think about how everybody in this system is going to be helped. So we work on expanding the care team and how to do that, even if it seems like there's no one available to help. We also have skill building meetings with multidisciplinary professionals. So make referrals to physical therapists, occupational therapists, dietitians, social workers, pharmacists, all these people who can, and nurses who can support the caregiver's well-being and increase the safety of both parties when the care is being provided. And then we also have care team planning meetings to make sure that everybody's on the same page and knows what their roles are. And that includes the primary care physician, other physicians who are on the care team, as well as a pharmacist, and most importantly, the caregiver and the care recipient are part of that. What we find is that levels of caregiver burden significantly decrease with participation in this program. The level of caregiver anxiety and caregiver depression significantly decrease as well. But interestingly, we also find that the number of days that the person stays in the hospital, the number of times that this is about the care recipient, the number of times they need to be hospitalized, and the average number of emergency department visits that they have in a year really diminishes when we look at 6 months before the caregiver is involved in our Caring for Caregivers program and 6 months after they finish up. So it has an impact on both the caregiver and the care recipient, although we can't say that, we are the magical being that's going to make sure that care recipients suddenly stay out of the hospital or suddenly don't have to go to the emergency room. What we're saying is that this is probably a part of a solution that is working. We have lots of wonderful caregiver stories to share, but people are very appreciative of this program and sort of shocked at how much they had not thought about their own needs prior to being asked and how little they felt like they could talk about those needs. So it's a program with an impact, and we are very interested in having you participate. There are lots of other programs at Rush that provide assistance for caregivers as well. And I imagine that the Rush Generations team will talk with you a little bit about that at the end of this program. But if you would like to contact us about caring for caregivers, please do. Our number is on this screen, and you can also send us an email at caregivers@rush.edu. So thank you very much, and I will pass the baton off to Sarah Chen.
Thank you so much, Ellen. As the screen flips to I'm going to talk a little bit about caregiving in the perspective of neurologic conditions, and specifically probably a condition that people may or may not be as familiar with, which is Lewy body dementia. It is a growing diagnosis that you may or may not have ever heard of. It's sometimes referred to as the largest disease that no one's ever heard of. It's the second most common type of dementia. And what can be really confusing about Lewy body dementia is it's in its name. It depends on, when specific symptoms start, but there's two different disorders that can be lumped under the umbrella, like the chicken and the egg in the picture to the right, that make up Lewy body dementia. And so it's a change in both motor symptoms and cognitive symptoms, as well as some non-motor and some neuropsychiatric symptoms as well. Next slide, please. And so in the context of caregiving, along the same lines that Ellen was talking about, caregiving can really change over the course or progression of the disease. And caregivers face higher demands and expectations, potentially by the medical system or those around them, to continue to help support their loved one. 83% of individuals living with Lewy body dementia reside at home and are paid for by non-paid caregiving, so family caregivers in some form. And often a big variable about how people living with Lewy body dementia really does have an impact on how people living with Lewy body dementia, how they're doing, is affected by how their caregivers are doing. So if their caregivers are feeling more overwhelmed, have higher rates of caregiver burden, it means that the individual living with Lewy body dementia has a greater risk for hospitalization or potential nursing home placement. And so, next slide. There's a researcher here at Rush within the movement disorders division that works closely with families and patients with Lewy body dementia. And she is leading a study to look at if there's a way that we can help support caregivers whose loved ones have Lewy body dementia. What kind of impact will it have both on the caregiver, and also what kind of impact will it have on the individual living with Lewy body? And Lewy body also encompasses Parkinson's disease. And so you, as the earlier screen showed, you might know people who might be more familiar with Parkinson's disease, and as their symptoms change, someone with Parkinson's disease may develop more thinking or memory challenges. And that also falls under Lewy body dementia. And so this is looking at, can education and support have an impact on family caregivers? It's funded through the National Institutes on Health. And it is a 5-year study that's completely virtual, and people can participate in a 12-week intervention that is, we hope, practical and relevant to tackle some of those topics Ellen was talking about, from kind of what are the care tasks that might be expected, or what are some symptoms that might be on the horizon. And as a care partner, what would be helpful to know now so that if one of those symptoms crops up, a care partner can feel a little bit more equipped or prepared to be able to identify it and spot it and either report it to their loved one's medical team to get support around, or have a little better idea of how do I manage this symptom? What are some strategies that could be used? And so more experienced caregivers are going to be trained as peer mentors that will be matched with newer caregivers. And so newer caregivers are being split into two intervention groups. One group that will be a self-paced, lighter intervention that people will go through on their own. And the other group will be matched with a peer mentor and have a more structured curriculum. Next slide. And so we're looking at what is feasible for caregivers. Is it feasible to meet with a mentor and go through the structured curriculum, or are people prefer the self-paced guidance that they're receiving? And we're going to follow caregivers. They'll participate in the 12-week intervention, and then they'll be followed for 6 months following the intervention, similar to the same things that the Rush Caring for Caregiver program is looking into. So what kind of impact does it have both on caregiver stress and burden and sleep and their own health, but also what kind of impact does it have for people living with Lewy body dementia? Regarding hospitalizations or falls or visits to the emergency room. So this program is certainly an option if you know of someone or you yourself are a caregiver for someone with Lewy body dementia or Parkinson's disease and cognitive changes, that you can reach out to us at the Caregiver or at the Persevere study. Next slide. And our information is here on the next slide. You can scan the QR code or send us an email. There's a screening survey that people can complete to determine if they might be eligible for this program. And I think to kind of the point of this presentation, both Ellen and I are mentioning that there are resources for caregivers. You're not in this alone, and please reach out and explore the available options, because we know that caregiving is so hard and we want to be able to help support you. Thank you.
Thank you to both of you. I'm sorry, I'm trying to unmute and to, hold on. Start video. Excellent. Okay. I'm hoping that Ellen will join us, but thank you to both of you. I was just thinking throughout that families take on the caregiver role usually due to a health or mental health or cognitive conditions. So it's great that at Rush there are programs with quite dedicated and talented clinicians as Sarah and Ellen and the caregivers, Caring for Caregivers group, offering services and support. Let me try to pull down that slide so that we can all be in the same screen. Franco, can you help with that? So that we can get to, there were already many questions coming in. I don't know why it's not coming up down. All right.
There we go.
There you go. Thank you so much. So there were quite a few of the questions that were coming in. I wanted to remind people of the number that you gave, Ellen, the 312-563-0350. And you also, don't worry, all of you listening or seeing us on YouTube, if you can always also call us at the Rush Generations toll-free number, the 1-800-757-0202, which you know so well, and we know where to find these clinicians. Okay, so we will get you to the right program. Just let us know what is it that you're interested in, what is your need, and we always connect people that way. I think that one of the things that I wanted to touch on first is, there are so many roles that you have to juggle, like you said, Ellen, and the one of advocating is so key, that the ability to say, I need help, or I simply cannot do this, like as the example that you were using, that's at times very difficult for people, but it's so needed. So finding the words, and this is why when you reach out to some of the providers, you can feel a little bit more comfortable saying, what is it that you need as a family caregiver? So I wanted, if any of you wanted to touch a little bit more on that before we open it to our callers, you can, if you wouldn't mind saying a little bit more about that advocacy piece, how important it is.
Well, I feel as though the self-advocacy is kind of what you're referring to, and how do I ask for help for myself? And many times people feel like I haven't collapsed yet, so that means that I'm doing fine. And it's not until there's some dramatic crisis that it feels like, okay, I guess I need to find a little bit of help. It's interesting when we do our caregiver burden survey with people and kind of look at what the different components are of caregiving and ask questions like, oh, how much do you agree with this statement? I feel like my life has been defined by caregiving, or I feel like my health has diminished because of caregiving. We find that it stirs a lot of feelings for people, and they start talking about those feelings. And it really does feel like I've never been able to even think about this for myself because I've been so busy taking care of other people. So it's just really important to do those kinds of explorations of where you really are so that you can get things that will help you before you hit a crisis point. You can avoid some of those crises if you manage some interventions earlier on that can help you diminish your stress or decrease your anxiety or help you feel less depressed.
Yeah, sometimes people think, well, or think that is selfish, but it's being proactive is what you're saying. So not avoiding getting to that crisis. How about you, Sarah? Were you gonna add to that?
I was just going to say that kind of thinking about or having some of those hard conversations or making some of those uncomfortable plans ahead of time around maybe advanced directives and getting some of those in place, or thinking about as a care partner, are there specific tasks that I don't feel comfortable doing? Is there a line? What is my line in the sand? In a sense, and kind of thinking about those ahead of time, those can feel really uncomfortable, but if you're able to tolerate doing some of that work, it allows that in the moment, if you do come to a point where you're in a position to have to make some of those decisions, you've already kind of done the work ahead of time. And so that crisis or that difficult conversation, a little of the work has been taken off of your shoulders around the added stress of being uncertain about a decision. Yeah. So that can be really helpful as well.
Thank you. Thank you. Any of the callers, you can press *6 to unmute. Going once.
While people are thinking about it, I'd like to add something.
Yes.
A lot of people have medical alert bracelets that that say what their condition is. For people with Alzheimer's disease, it's especially important because they may wander And there's always a first time for wandering. So waiting until that first time happens, you've already put the person at risk if you haven't gotten some sort of bracelet for them that can avert that crisis from happening, where they get lost and cannot be, takes a long time to figure out who they are and where they came from. But caregivers need to have one of these bracelets as well to say, I care for someone at home or in their home or whatever. Because if something happened to you as a caregiver and you went to the emergency room, there would not necessarily be somebody at home to take care of that person. So if you don't have backups built in already, it's important to have that kind of medical or backup.
Oh, wow. I like that. I like that. Yes, yes. I know there's so many of those bracelets and oh my gosh, what you said about there's a first time for wandering gave me a little bit of chills. So
yeah, it's
yeah.
true.
All right. I don't see colors on muting, but then I'm gonna start with one of the last questions we got, which is around the social isolation, which the person states is something that is overlooked so much. And I didn't think how that could impact caregivers. What are some ways that caregivers can stay connected to others, even virtually? Great question. There are some friendly color programs that we know about, but any other recommendations that you may have?
Even virtual support groups, whether it's disease specific or general kind of caregiver groups, can be a nice way to connect, but also caregivers might want to connect about just something that interests them.
Yeah.
If it's a book club or there's a faith community that they're a part of, or they're into a particular craft, or, who knows, but connection can look like a lot of different things. And there are plenty of virtual options kind of based on a theme that might kind of be attractive to you as a care partner. It doesn't have to just be connecting around your role.
Yeah, there are also a lot of Facebook groups that are very specific about diseases, and that can be a way to find some of these groups as well.
Thank you. All right, from one of our, from YouTube also, I am a caregiver for my husband who had been diagnosed with stage 4 cancer. I wanted to know how often should a caregiver take time out for themselves? I feel tired and often. Thank you for that.
I don't think that there's a standard amount of time. I think that it really depends on the person. And if what you're feeling is overwhelmed, tired can mean exhausted, or tired can mean just sleepy and I could use a nap now and then. So, it would be a good idea to connect with someone who's able to help you kind of sort through what the situation is, what the options are. And, it's interesting because underneath this question, I'm hearing a question about, is it legitimate to want to have some of that time, and how much is too much? And I would say there's no magic number about this. It's entirely legitimate to want to have some of that time. And I would say start with what's feasible and see how that feels. And then if you feel like you could use more and can get built in easily, certainly do that. Sharing the load equally among lots and lots of people can work really well. And it can provide the care recipient with a lot of social contact that they wouldn't otherwise have. So that's something to really think about.
I love that. I love that. And sometimes when we think about doing something is outside of the home. If you feel comfortable in your home, still staying around, is good to have other people to talk to and not necessarily with the same person over and over. So thank you for that. Let's move on to the last question, which is from a caller. I see somebody unmuted, so are you?
Yes.
Good.
Yes, my name is Dolores Dixon, and it's like that ideal that you brought up about having like a what you call it, a bracelet or a medical alert for the caregivers, because it's like if something should happen, and everything, because it's like I remember I had to go into the emergency room, and then all the time I'm like, I just got somebody on the spur of the moment, to like go home and take care of my mom, while I'm in the emergency room, and everything. And that was more nerve-wracking than me worrying about my symptoms. I was more worried about my mother at home, what was happening with her, and everything.
Sure.
So yeah. And I know my sister-in-law is going through the same thing with her brother, because he's like mentally challenged, and he's getting older now, and he's beginning to be like more of a burden, and he's been in the hospital a couple of times and everything. And it's hard because sometimes, to get family members to help out, everybody's busy, everybody's working, or they got children to take care of or whatever, and it's hard. And then like me, I'm like paying out of pocket to like have someone to come in to take care of my mom, and everything, because it's like, I had people from the Department of Aging, and, that helped, but then I went through so many of them, Yeah. It is very difficult, and I think I'm in the position that I am now because it's like I have just burnt out my body. My mother passed away, 3 years ago. She was 96, and stuff, and I was able to take care of her at home, and it's like now my body has broken down. I have like very bad arthritis now. I'm using a walker, and I'm thinking about myself because I don't have anybody to take care of me because I was taking care of mom, and everything, and now I'm thinking about, oh, okay, I'm gonna have to focus on self now.
Absolutely.
Yes.
Yeah.
The sooner the better.
Yes, yes. I like what you said. It's about crisis, proactively avoiding any crisis. Well, thank you so much. Thank you for everybody. Anybody wants to comment on that last piece? I appreciate you. Go ahead.
I was just gonna say, I think it really sums up being the role of being a caregiver and all the different pieces that people are facing along the way, and the juggle that it involves. It's a lot.
Absolutely. Yeah. Well, thank you for that, and also thank you for the comments and questions from our audience, and a huge thank you to both of you for joining us aside from your busy schedule. So I greatly appreciate you doing that for our Rush Generations members. And we hope it's not the last time. So I'm gonna just now tell the audience what are some of the upcoming programs that we have for you. And one of the first ones is with falls prevention. We need to stay strong throughout our lives. The Matter of Balance is a 8-week session workshop for individuals who may have begun restricting their physical or social activity because of a fear of falling, which at times happen after one or a couple of falls. The workshop utilizes problem solving, confidence building, and balance improving exercise, as well as cognitive restructuring to help the participants prevent falls, improve their balance, and regain the ability to do what is most important to them. The next workshop that we're gonna have is virtually through Rush Generation. Sorry, we are still in Matter of Balance. Through Rush Generations, it's gonna be via Zoom on Tuesday and Thursdays starting January 14th through February 11th from 10 to noon. Then we have, Fit and Strong, which is also free, a free workshop that uses flexibility and strength training, aerobic walking, and health education to improve your balance and strength. This 24-session exercise and education class is delivered 3 times per week for 8 weeks. And the next workshop will be held in person at Rush on Mondays, Wednesdays, and Fridays, also starting in January 22nd, and it goes through March 17. It's for an hour and a half, so from 1 to 2:30 p.m. Again, any of these programs you're interested in, feel free to give us a call at 1-800-757-0202. And we want to hear from you. The Shulman Senior Voices program aims to empower older adults and caregivers to discuss what matters most to them as they age. It is important to share what matters most to you, not only to your providers, but also to your loved ones. Once you record a video, you get a mini clip for you as well. So we want to hear from you. Please consider sharing your wisdom on why it is important for your healthcare team and your loved ones to know your goals, your wishes, and what matters most to you. You can scan the QR code to record on a mobile device or a smartphone. And finally, we'll have our next lecture pretty soon is age-related hearing loss on Wednesday, December 4th, again, started at 1 p.m. So we hope to see you then. And until then, take good care.